Now, speaking of accidents, Buffalo Bills player Hamlin experienced some sort of cardiac emergency on the field Monday night. Now, local cardiologist Dr. Michael Holmes from the Bassett Healthcare Network explains what happened and the concerns and questions some may have surrounding contact sports like football.
He had a cardiac arrest on the field, so his heart went into ventricular tachycardia or ventricular fibrillation, and he rapidly lost consciousness, and then had bystanders come in, team group come in and do CPR, and ultimately, I understand, was defibrillated.
Dr. Michael Holmes explains that a cardiac emergency such as this one is estimated to occur between 2 and 4 people out of 100,000 and is an uncommon problem among young athletes. Holmes says this looks like it was a contact issue.
So there's something called commotio cordis, which has been described, and it's a projectile, so a hit to the heart. And the issue is that there's a certain portion of the cardiac cycle, so the heart's electricity causes the heart to contract, and then the electricity goes through what's called repolarization, or going back to normal. And that's a specific time frame when the heart is susceptible to arrhythmias if it's hit at that time. And so we see that clinically in cardiology. So if someone has a premature beat that comes on right at the time of the T wave, it can cause ventricular fibrillation.
Dr. Holmes tells me that an incident like this should not deter parents from letting their child take part in an organized sport like football. However, there is one preventative measure that parents can take: having a pediatrician examine their child for underlying cardiac issues.
And ask things like, have you ever had a fainting episode? Have you ever had exertional pain in your chest? Do you have troubles where you feel like sometimes your heart takes off and races? Do you have a family history of someone dying suddenly at a young age? Because many of the issues that would make people prone to this are genetic. And then kind of a physical examination.
This medical emergency has sparked one question.
Should all athletes have an EKG or an electrocardiogram?
However, Dr. Holmes says there is a cost for conducting routine EKGs because it is probable that there will be a number of false positive results, leaving this proposal up for debate. Reporting for Eyewitness News First at 10, I'm Lauren Brill.